Letitia Ward. I'm out here because I want to be able to retire. I've been at Kaiser 28 years, and we're supposed to, all employees of Kaiser are supposed to work in partnership. There has not been a partnership. If there's a partnership, we wouldn't be out here.
And are you surprised that doctors, according to the rally, said that they think you're making too much money?
I'm very surprised at that. We work hard for this hospital. We work hard for our doctors. We work hard for this organization. And for the doctors to feel like we're not good enough or don't work hard enough or should be paid enough, it's ridiculous.
They're making a lot of money, the doctors.
Yeah. Oh yeah, without a doubt.
So if they get rid of you, then they can bring in somebody less paid?
It just shows what they feel about us. That's what it shows. It shows what they feel about the people that work hard for them every day.
Dominic Cobaruvius, work for EVS. I'm out here supporting my fellow workers. We're understaffed, hard workers, underpaid. We hope we get a raise. I'm born and raised in San Francisco. It's hard to survive out here off of what we get paid right now. So, I'm born and raised and I want to stay here. I'm not trying to move. I want to stay in the city I was born from.
And what is your pay?
My pay right now is like $30.
That's hard to live on in San Francisco.
Hard to live on in San Francisco. It's one of the most expensive cities in the world. That's how they treat us.
They're making billions, it seems.
They're making buildings. I got friends in other union, construction. All the buildings are going up, but all the real San Franciscans are moving out, getting pushed out. And this is part of the issue right here. I've seen it my whole life. A lot of people don't even live here no more because they can't afford to live here, and I don't want to be one of them persons. I want to stay in my city.
My name's Sydney Simpson. I'm a nurse at Kaiser San Francisco.
And you're out here even though you have a contract. Apparently you got a good raise, 22%.
We did, yeah.
And why aren't they giving the same kind of benefits to these workers who are out here today?
That's a really good question. I think it's a matter of power and flexing power and calling a bluff. I think Kaiser thinks the people out here are bluffing. So it's our responsibility to get out here in numbers and solidarity and show them that we're not bluffing.
And they say that staffing is a major issue. How is staffing affecting this hospital?
I can speak to my unit specifically, but some of the people out here are people we rely on for turning over the procedure room in between patients. That process should take about 10 minutes, and sometimes it can take up to 45 minutes, and that's because of a lack of staffing. It's not the fault of the people turning over the room, obviously. They don't have enough support, but that delays patients, and you delay enough patients through the day, you end up canceling a patient at the end of the day, and that's a problem, and it cripples all of us to not have enough people in every single modality.
So the members of Kaiser who pay money for Kaiser, you think that they're not getting really the kind of treatment they should get?
I think it's a really good question because especially if you have a choice of your insurer, you look at the price tag on all insurances. You pay the highest price, you expect the highest quality. So I think it's a great question, where is my money going? Am I getting the best possible care? Every patient has to decide that for themselves. I know that when we come to work, we provide the absolute best quality care possible for us, but we have to have enough people every single day to do that. If we're skipping our lunches, if we're having to stay late, you're not rested. You're not providing the best care if you haven't eaten and you're not rested. So we're asking for basic things. These people out here are asking for basic things. They want to have their lunch, they want to leave and go home to their family on time, and they want to be paid a living wage. I think that's reasonable, and I think Kaiser members would agree with that. And
they reported today that the Kaiser doctors are saying that they're overpaid, they want to outsource their work. Is that a concern to workers and in general? Because I did know they outsource the bus operators and they want to outsource jobs. I mean, they outsource the dialysis centers. That's another issue.
It is an issue, yeah. It's those things you don't maybe necessarily hear about every single day in the news as a member, but that's right. The shuttle drivers are no longer Kaiser employees. We no longer have a dialysis center here, So if you come to
you used to have a dialysis center here.
That's right. Yeah, that's correct. So if you come,
do you think that should be allowed?
That's above my pay grade, but as a nurse, no. I would love if we had dialysis available for every single person who needed it, and that wasn't outsourced, to non-Kaiser employees. I would love to feel like I had a full working team at all times.
And the CNA has called for single payer for national health care. There's a healthcare crisis. It seems like it's getting worse for healthcare workers and people in the United States who need healthcare.
Yeah, it's really interesting when there are healthcare workers out here today and frankly all over the country who are sleeping in their cars in between shifts. But Kaiser is positive, what is the number, $3 billion at this point for the year, for the quarter. I mean, I think it's like a pretty clear discrepancy there. Like there is money to pay these people and to get them their breaks and to hire an appropriate amount of people, but it's going to the ethos, it's going to the Kaiser overlords. I'm not sure, but when you see those numbers, profit numbers, and then you know that some of your coworkers are sleeping in their cars, it doesn't sit well. So that's why I'm out here.
That affects patient care, doesn't it?
Absolutely.
Sleep in their car?
Absolutely. No one should ever have to sleep in their car, but you know, when you think about people working in a hospital, you think like that's a good job. Those people have good jobs, good benefits. Then why are they still having to sleep in their cars? Why are they having to drive lift cars in between their shifts? You know, it's inappropriate. The cost of living in San Francisco and a lot of places is, you know, it's tough. It's tough to live here. So if we work here, we should be able to afford to live here.
Do you have a no strike clause in your contract?
In the CNA contract?
I mean, could you join them? It seems like if everyone went out together, that this wouldn't be a long strike. And also the engineers were out and they basically went back to work without a contract. I mean, that must be pretty demoralizing to workers.
Yeah, well, so it is within our right to not cross a picket line, so some of our members have chosen not to cross this picket line. So that's why you see some of us out here. But you know, some of us chose not to cross the picket line with the engineers, and then we had our own strike as CNA earlier this year. So you know, like the lack of pay gets very real very fast, especially if you're living paycheck to paycheck. So even though CNA is not technically officially sympathy striking, those of us that can't afford to be out here are out here. Some of us come out on our lunch breaks just to show solidarity. We're doing our best, but at the same time, like, not a lot of us have these big coffers that Kaiser has to dip into when we miss, 2, 3 days of work.
I'm a PCT. I've been here for 24 years. Everybody knows that PCT working hard. Kaiser should give what we fight for. Especially all the ones who are do overtime. We need this. We have to be united. Okay? That's all.
We got Issa Lewis. Come over here. She's been at the bargaining table for us.
All right, thank you everybody from San Francisco. First, I want to thank you for your sacrifice. You are all sacrificing your pay, your time, your money, your energy. So, we want to thank you for that. I am the CIC for the bargaining team for San Francisco. This is my 4th time doing it. I have Sherman Harris. He's my brother, EVS, y'all EVS leader. He's on the bargaining team. We want to give him a round of applause. We have April Crawford. She's from Mission Bay. She's part of the bargaining team. We have Eugene Wong, which is from IT, which is part of the bargaining team. And we have Angie, but she went on maternity leave, so she abandoned us. So we've had countless numbers of meetings with Kaiser. And right now, Kaiser is arguing amongst themselves. We left last night at 12:30 a.m. and we were told, 15 days straight we've been working with Kaiser management. Gregory Adams has not come to the table, not one time. Yesterday we had the Secretary of Labor fly in from Washington to meet with Gregory Adams. That was the only and first time that he came to speak on behalf, out of his own mouth, on behalf of this fight. Right now, currently, KFH and TPMG is arguing. The doctors do not agree with the increase. They do not think that we're worth it. They told us face to face, we want to do it for cheaper, and we want people who do it better. How disrespectful is that? I also want you to know that they are looking at outsourcing, which is a reduction in force. They want to reduce and outsource our revenue cycle, which is 19 classifications. 19. I don't know if you all remember in 2019 we had the National Pharmacy Warehouse Workers. They got outsourced. We had 4 individuals that died because they lost their minds. They couldn't take the pressure of what Kaiser took from them. So just imagine, and I don't want to start crying, but I had to deal with each one of these individuals. Each one of these individuals talking to their families about the jobs that they're losing. Individuals that worked in a national pharmacy warehouse for 40 plus years, and to be told, you have to go learn a new trade. We can no longer pay you $50. We want to use someone better for cheaper. So right now what you're doing on today, we just want to thank you on behalf of you coming out here, because we couldn't do this without you. We could not do this without you. So we stand in solidarity. And every day before we went to bargaining, we would touch and agree that God's will be done. So understanding that none of this is by accident. We have to show Kaiser, if God allowed this to happen, this is what's supposed to be. So you continue to fight, because when we fight, we win. When we fight, we win.
I'm Edith Hurtado. I'm a medical assistant OBGYN Mission Bay. A shop steward, and as a medical assistant and being in bargaining tables with Kaiser, I have to tell you guys that I have to be more than thankful to Isa. That work, it's hard. And to listen to Kaiser executives treat us like we're not worth anything, it's the worst thing you could ever hear. The other thing I want you guys to understand, like Isa, Raul, and even Edward has been saying about outsourcing our jobs, as a medical assistant, you can do lab EKGs, right? So what can happen is that if Kaiser decides to take our lab techs, they're gonna ask the medical assistant to do that job. Then they can take the EKG and have the medical assistants do that work, but not for more work. I want you guys to all understand that this fight is huge. We're not fighting for one person or one classification. We're working and fighting for everyone here.
My name is Ellie Kung. I'm with ESC Local 20.
And what kind of work do you do, Ellie?
I'm an optometrist. I'm a doctor of optometry at Kaiser San Rafael. I live here in San Francisco.
And are you affected by this staffing as well?
I am here in solidarity to support our SEIU, UHW brothers and sisters. Without them, we cannot do any work. We need them. They are there to help us with patient care, to make sure that quality stands. They deserve better staffing. They deserve better pay. They deserve to be recognized as equal parts of our team, and that they are essential.
And how many unions are on strike out here?
We are the coalition of Kaiser Permanente unions. We are 75,000 strong out in the nation right now. We are 12 unions collectively. We are here to support SEIU UHW against the unfair labor practices that Kaiser is committing at their local table, and we are asking Kaiser to come back to the table in good faith bargaining. We do not appreciate any of their bad faith bargaining that they've brought to our table.
And what do you mean unfair? What are they doing unfair?
We have been working since April, and this is something that could have been avoided. We actually need their decision makers to come to the table sooner, and should have worked with us faster and supported our SEIU UHW our brethren with staffing and better pay.
And Kaiser apparently made billions, over $1 billion last year. Why can't they afford what you're asking for?
I'm not really sure. They're spending a lot on money on travelers at this time, and we're asking for them to spend it back on the people who've been on the front line throughout the whole pandemic. We've shown up every day, and SEIU UHW deserves every single bit of what they've asked for.
How many members do you have here?
For SEIU or?
Your union. Your union.
As Local 20, IFPTE, ESC Local 20, we are 1,900 strong.
So that's a lot of workers here in San Francisco.
Well, we're all across Northern California.
And this is a national issue of Kaiser. It's happening all over the country, Washington, D.C. and other places. There seems to be a general crisis in healthcare in the United States. Americans spend more money for healthcare than other people, yet you've got millions of people who don't have coverage. What do you think about the situation of healthcare in general?
I think we can do better, and I think we need to put our patients first, and in order to do that, we need better staffing and to be able to retain and recruit workers so that they don't go, so that our patients benefit from it most.
We're standing for our rights, man. Everything else, the price of everything else is going up.
Can't survive.
Yeah. We're here, actually, we're laying the foundation for our children and our children's children and the generations to come.
And, you know, you talk about the future. It seems like you can't survive on the wages you're making. Is that the case?
Yeah, you can't. We can't.
How long have you worked at Kaiser?
20 years.
What kind of work do you do?
I work as a medical assistant in the rheumatoology department.
And how have you been affected by the lack of staffing?
I could write a book, but we're glad to be.
Give me some examples.
Staffing issues, more workload, less staff. That's the bottom line.
And the patients here, I'm a Kaiser patient. You come here and the workers are stressed out, you're understaffed. You think, what are the members of Kaiser, what should they be doing?
What's that?
What should the members of Kaiser be doing about it? Because there are 9.4 million members, a lot of you.
Support us, stand by us, right? I mean, as a community, as a country, I mean, we need the support of the people. We work for one of the biggest organizations in California, so as much support as we can get, hey, all good.
There's a strike, sympathy strike today, SEIU contract with Kaiser for the healthcare workers. The issue that I know of is wages, the staffing shortage, and also the bonus that we receive every year.
And Kaiser's got apparently a lot of money. They made billions in profits last year.
Yes.
What's going on?
I don't understand it. I'm about as lost as you are.
And a lot of these people are stressed out because of the shortage, staff shortage. What's going on?
A very shortage of staffing that I don't know why they don't want to increase the staff. And they're saying they are, but it's still the same. Year after year after year, it's the same.
You work at Kaiser?
Yes, sir.
What kind of work do you do?
I do gardening work here in San Francisco.
And how long have you worked with Kaiser?
Here I've been 10 years.
How has it affected you?
Well, I mean, we don't have enough people. So therefore, it's a lot of work, but less people. So therefore, we need more people.
And they say that they don't have the money. You don't believe that?
No. Kaiser, no money.
And the whole healthcare system in this country, it seems like people are making a lot of money. The executives make an incredible amount of money. You think that there has to be a fundamental change in the healthcare system?
Yes, a lot of money. And, you know, I don't know why they can't meet our demands. It's not like it's way out of proportion. You know, it's in line. You know, with the cost of living here in California, everything is high. You know, gasoline, everything. I mean, you know, cost of living. We have to look at the cost of living. It's high.
My name is Raul Sanchez. I'm shop steward. Been here at Kaiser for 7 years. I got a kid that works here, a wife that works here. We out here because we are the people that make this hospital run, right? And what are they bringing in over here? They're bringing in these people outside, paying them 3 times what we make. But guess what? They can't do what we do. That's why we out here, right? Because we fighting for every day. We can't even live in a place where we work. And with these wages they trying to give us and short staffing, I mean, it's funny how they bring 3 busloads of people up in here to do our jobs, right? They've got more people working in here when we're here. So the understaffing is a terrible thing that's happening to our patients up in here. I mean, that's real. Everybody that's out here needs to realize what's going on. The outsourcing that they're trying to do is terrible. They want to hit up all our jobs. They want to make sure that, you know, we can be replaceable. They're busting unions up left and right. All of us need to stand by. All of us need to make sure that we out here by one another, because guess what? We're the ones that make this hospital run.
I'm Melinda. I'm one of the social workers. I actually am a social worker for the emergency room.
Okay, I'm gonna go hide.
And this is one of my co-workers, Melissa. She's the inpatient social worker.
So how are social workers being affected here at Kaiser by the shortage, staff shortage?
We definitely need more social workers to fill the positions. We have open positions. We've had open positions for a while, and we need social workers, and we need money to be able to make the positions look more pleasing for people to want to come into San Francisco and work.
Well, Kaiser made billions of dollars last year. Why can't they pay enough to get social workers here at San Francisco at the Kaiser facility?
Well, I think we're still waiting on that question, on the answer to that question. We're still waiting why we didn't get our bonuses. It's not very much, and I don't understand why we didn't get it. So we still
How much were the bonuses?
Usually a couple of thousand at best, but why couldn't we get them?
Well, the executives seem to be getting bonuses.
Oh, absolutely. They get bonuses. They want discharges. They want less for more. So, I don't know. I guess we will get answers eventually.
Are you concerned about the threat of outsourcing? They want to outsource?
I am. That is a very big deal, especially for some of the workers. I mean, I feel like I'm essential, but people like EVS that clean our hospitals, I feel like they're more essential than I am, because if you don't work in a clean environment, then that is disgusting, and it's dangerous for our patients, and it's dangerous for us to be working in that type of environment.
And during these other strikes that have happened in UHW, stationary engineers, there were serious health and safety problems here at the hospital.
Yeah, we had to wait a long time for simple things to get fixed, and some of them didn't even get fixed. So, I mean, one operation affects the whole operation. So I don't understand how people are comfortable with the whole operation being affected.
I'm Tawana. Today we're fighting for our employment. We don't want outsourcing. No outsourcing. We need to be able to hire within and hire more people. To make it more caring. We need a caring facility. It's a caring. They take care of you, but it needs a little more TLC. And we don't get that TLC if we're hurrying up and going to the next thing.
They've been trying to outsource. They outsource the bus drivers. The dialysis center used to be Kaiser. Now they're outsourced, and we're the real problem. What does that mean to the members when they start outsourcing jobs?
Well, me, being a member, outsourcing takes away from part of the caring, because they're just here to do a job and go home. They're just doing the job and going home. We're caring. We're part of the caring team.
What about the executives who are making millions of dollars? I mean, it seems like they have no problem with money.
They don't. But I can say, for me, if I had to pay rent, I couldn't afford it, especially here in San Francisco with the wages that they're paying.
And it seems like the whole healthcare system in this country is in crisis. The same is going on at Sutter. There are strikes. I mean, you think there should be public health care in this country? I mean, to get these business executives and billionaires out of healthcare?
Well, we know everybody has to make a living, right? So I'm just...
I mean, do you think that these people are doing anything good for healthcare? All the money that they're making, putting in their pockets?
I think they should add a little more to it. Maybe give and take a little.
Seems like they want to take away from you. That's where they want to...
Right. But if they gave a little more, you know, we all have to make a living. That's what it boils down to. We all have to make a living.
Community supporters who have come out to speak to you, and I have the pleasure of introducing you to Elaine from the Filipino Community Center here in San Francisco.
Good afternoon, UHW. Make some noise for yourselves. You are a part of making history right now as one of the biggest, if not the biggest, healthcare industry strike in all of U.S. history. Make some noise. Congratulations. If it was not for workers like you fighting for what you deserve, fighting for what your patients deserve, fighting for what our community deserves, we would not have progress in this country. Am I right? It's not just for your concerns, it's because you care about quality care for your patients. You care about your families and their livelihoods and their future, and you care about this community getting the kind of health care that we deserve. You know what we don't care about is the billions of dollars of profits that Kaiser executives keeps putting in their pockets. You know what we don't care about is how much sleepless nights they're gonna have until they give you what you deserve. And you know what we don't care about? We don't care that it will cost them some money, because you are the people that make this industry go around. Make some noise for yourselves. It's October, and here, October is Filipino American History Month. So I want to congratulate all of the Filipino siblings here. Magandang tali po sa inyong lahat at salamat sa inyong pakikibaka para sa inyong karapatan at para sa unlad ng ating bayan. Not only are you making history in the healthcare industry, you are also making history in Filipino Americans all over the world, all over this country, and for Filipinos that look up to you and depend on you in the Philippines. Thank you so much for your service, and thank you for your fight. Again, I am with the Filipino Community Center, and we want to say that we are in solidarity with you. We are here at this picket line. We are mobilizing more of our members, our allies, the students in the universities, so that we can come out and show that we appreciate our frontline workers. We are going to be at the strike lines today, tomorrow, on Friday, and however many days it's going to take until you get what you deserve. And I'm going to teach you two chants, okay? When I say, when workers' rights are under attack, and you say, what do we do? And your response is, stand up, fight back. When workers' rights are under attack, what do we do? Stand up, fight back. Stand up, fight back. When workers' rights are under attack, what do we do? Stand up, fight back.
Y'all, why are we always out here? CNA, the engineers, now we out here with y'all. But guess what? I will be out here with y'all. I'll be out here tomorrow. I'll be out here Friday. I will be out here as long as we need to be out here. And as CNA, we know that sometimes we need to be out here for a minute.
Yes.
But you know what this is? This is Kaiser thinking we're bluffing. And we are not bluffing. This place cannot operate without these people out here. Okay? And as nurses, we know that. Do I want to do my job without you? Absolutely not. That is terrifying. That is unsafe for patients. And not paying workers a living wage is unsafe for patients. We need the people out here to be happy and healthy and taking care of their families so they can show up on time and do a good job. Okay? But we have to fight for that. That's what we're doing here today. I'm with you. I hope you know I am not the only nurse with you. I'm the only one willing to talk on this mic, but